I think YouTube is finally on. You are live. Yes. Who is on YouTube? Join me on YouTube. Today we're going to talk about, we are on episode 7 on our anxiety journey. Today we are talking about selective mutism. Selective mutism happens in adults and in children, but we're going to focus on children. Yay, I see one person join on YouTube. Join us on YouTube. We are going to log out of here. So if you really want to benefit, especially parents, young parents with kids, join me on YouTube. All right, selective mutism is the topic for today. Join me on YouTube. Mm, mm, mm. Well, I'm eating my candy. Eating my candy. I don't get to eat candies often, but I gotta eat some candy. Thank you. I see 2 people. Um, I'll do this so I can see comments. Let me go to this computer. Join on YouTube. I'm gonna log out. This is just to announce on Facebook that we are on YouTube. So join us on YouTube because I'm gonna log out of. I'm not doing the education on Facebook anymore. I'm sorry. Let me log on to the computer so that I can. Boogie, you want to help me here? Or maybe when I log out. Oh, never mind. I'll use this. Never mind. Let's share the link on Facebook, YouTube to Facebook. Who is joining us on YouTube? Selective mutism is the topic. There you go. We have 4 people here. Thank you. Oh my, hold on, people. I think I need to change something in it so that I'll see comments. And no, it's not for children. That's why I'm not seeing the comments. Okay. Let's see if that works differently. Yes, my friends, we have 6 people on YouTube. If you want to be part of this class, you need to join us on YouTube. Selective mutism, anxiety episode. We're still on anxiety, people. So join on YouTube. No live chat on YouTube. I put it on now. Yay, it's on. I put the live chat on. It's on now. I see Al Johnson. Hello, Miss Johnson. Miss Grant, can you check for me? And let's see if the chat is on. Because I see one chat now. Yeah, my son set it up for me and I didn't pay attention. So if you want to be part of today's Psycho Ed, yes, Miss Johnson, hi. If you want to be part of today's Psycho Ed program, you need to join us on YouTube. We are live on YouTube. All right. I'll give it one more moment and I'll start. Okay. Today's topic is if you have children, you have young children, it's important you join today's topic. Ooh, thank you, Mrs. Gloria, for the 50 stars. It's important you join. Okay. Or maybe I'll leave this Facebook one here also, but I'm not trying to leave it here, really. Let me see if how long I can leave this Facebook one sitting here. I don't know. Maybe I should, maybe I don't know. I don't know. Anyway, let's get started. So, like you guys know, I'll be reading, right? We read here. We read evidence-based articles here. We use it to teach here. And that's what we're going to do again today. Today's topic, I feel like, is a very important topic because, a lot of people have children with ADHD tags, conduct disorder tags, um, antisocial personality tags, or she's shy tags. And as a result, your children get mislabeled because of these damn IEP things that they do in the school system. How do you know to help your child? How do you know to identify the right situation your child is having and what your child to have the right services? Truth be told, history has taught me a lot and experience has taught me a lot, both personally and clinically as a specialist in mental health. Thank you so much, Miss Grant. Whoa, whoa, whoa. Thank you for joining, Miss Grant. I appreciate you. Join the YouTube page, people. Go and subscribe and join us. So if you have a mother with a young child, a teenager, I think this class will be an eye opener. As I'm, diving into it, I feel like, oh, I should have even done this way earlier, research into this way earlier. Because I also have children, I'm kind of, how you are in nursing school doing psych rotation and you kind of self-diagnosing yourself. That is the feeling today. Yep. So if you're a mother, you are a father, you are a young parent with young children, I feel like this class is definitely a go-to class. So come and join us on YouTube and let's get started. I'll try and hold. I don't want to be on Facebook with my psycho edge classes anymore because some people that insult you don't deserve your presence anyway. And I know most of them are not on YouTube. They can't. They don't want the discipline that Big Brother YT um, brings to the YouTube platform. All right, so let's get into it. But selective mutism affects both children and adults, okay? But I kind of want to focus on children today. During the course of the week, we may do adults also. So you know how it affects people. Just like parental alienation, when you don't take care of it, how it eventually affects the children. I want to try and put this. I want to put this in the place where that's why I want to manage one platform today, guys, for this. So if you don't want to join us on YouTube, I may end up logging you out of here. All right. So kindly join us on YouTube. Go and subscribe to the YouTube channel. All right. Yes. So before I start with the introduction, I want to know, what are you up to? What do you want to do today? What are you trying to achieve today? Being here with me. What is the goal? What is the plan for you today? What's the plan for you today? You want to tell me what the plan is for you today? I'm going to try and do this from the DSM-5 standpoint. Maybe I should put you guys here, the Facebook group. Maybe I'll put you here. Let's see how it goes. But my focus really is on the YouTube group today. All right. Bonjour, bonjour, bonjour. How are you? Okay. Welcome back to Power White. Run up on them, Cora. Run up on them, PDK Nation. Run up on them, Power White lovers. Yes, we are here with another episode of what's the name? Psychoeducation, and this is the anxiety series where we talk about different disorders that affect us. And today I feel like it's one of those that focuses on children, and we need to come and just get any little information out of it that we can, so it may change the way we approach our kids, the way we seek and advocate for our children, the way we support our children. And I feel like it's one of those that is important. Children and their foundation is my focus on Upper Worldwide. It starts from parental alienation, where a parent is alienating a child and eventually it affects the child psychologically throughout life if care is not taken and actions are not taken to resolve it. Same here with Selective mutism is a form of anxiety disorder that affects children, but eventually also affects adults, teenagers and adults, because if it's not resolved or if it's not identified early in result, then it can become a lifelong situation. Yes, I have acknowledged all of you. If you don't see me mentioning your name, understand that when it comes to psychoeducation, I try to want to stay focused and direct to the point so we can finish on time, make it brief so that it doesn't linger too long. So even if we finish and someone come later and they want to watch it, they are able to really watch to the end and benefit from it. All right. So thank you for being here. My name is Mamla Yoko Godwins, and I am a psychiatric nurse practitioner. And I have two boys. I'm a single mother of two boys. And I am a proud divorcee. Yes, I always say that because we try to eliminate stigma here. We try to own up our narrative. Being a single mother doesn't mean the world has come to an end. Being a single mother doesn't mean, being a divorcee doesn't mean that you shouldn't have a life. Being a divorcee is not your name, really. It's just part of life. And hey, like I keep saying, if divorces are 50% or more today in our societies, what do you think? The 50% living in it, they just tolerating each other. It's not everybody that is enjoying it. So, and don't feel depressed or, let anybody make you feel less of a person than you are because you are a divorcee. All right. So today is episode 7 on our anxiety series, and it's focusing on what childhood anxiety. This is selective mutism. So selective mutism, what is mutism? Mutism is a childhood disorder that is distinguished by the failure to be able to speak in particular settings or situations, according to what the DSM-5, the Diagnostic and Statistical Manual. What is the Diagnostic and Statistical Manual? If you are here, the 5th edition, you know what it is because I've been talking about it. That is a manual that we psychiatrists, psych nurse practitioners, psychologists, psychotherapists use to diagnose people after they assess you. There's a specific criteria. If you've been following me on Facebook, you know that this is what something that we use because I've used it and I show you the criteria. We use criteria. You may have similar symptoms from a person to the other, but it doesn't necessarily mean you are having the same diagnosis. Depending on the duration and everything, how when it started, what is triggering it, can all come into place. If you have any somatic issue, if you have infection, if you're on any medications for your infectious diseases and stuff, all that can contribute to affect you to feel like you have a diagnostic, a mental health disorder when in fact you don't. So that's what that is, okay? So according to the DSM-5, when it says when a child is in social situations, you see a child that is in school, they can talk. You will see a child that you take them out, they don't want to talk, and they feel anxious, then they stay back, then put their head down, they clench their feet, they clench their fingers, they don't want to give eye contact, they don't want to interact. They have social anxiety issues. Those kids, majority of the time, may be mislabeled as defiant, as non-compliant in school systems. So this is why it's important for you to know these symptoms and how to strike difference in it. Okay. All right. So children with selective mutism are frequently not diagnosed with the disorder until what? They enter school at around the age of 5. That's what they said. If you ask, statistically, they said 140 children have selective mutism. So 1 in 40 children, that is pretty significant. And it needs to be paid attention to by parents, right? What was once thought of as a rare condition, selective mutism, affects about 6 out of 1,000 children, which is the same, similar, averagely 1 in every 140 children. So 6 out of what? 6 out of 1,000 children have it. because of the because of misconception that surround the condition, many parents and other adults may believe the child is being disobedient and adversarial, like how they have conduct disorder. You think, oh, they are just being disobedient, they are just being oppositional, they are just being defiant. But that is not it. It's because they have anxiety when they have to face society, they have to face environments where they have to perform in groups. They are in school, they have the inability to engage in a group activity. They have the inability to do group projects. They have the inability to be able. People, are you going to join on YouTube, or now? I'm going to log out of this place. If you want to join us, you are free to join us. But for right now, I'm logging out of Facebook. Thank you very much. Sorry. Yeah. You see that? So sorry about that. Got distracted. In addition, children with selective mutism show different behaviors, which sometimes can make it difficult to diagnose. Okay, many children have confident issues in other areas, except for speaking and progress normally. Normally, I remember that, and I'm going to share this with you guys because you guys love me, so sometimes I like to share with you. This thing here is trying to bring my mind onto even one of my children, right? Where I will get a message when you have parent-teacher conferences. They will tell you that when it comes to group activities, he don't like to engage. The teachers will make him talk, but talk how much? Just a minute, be able to talk, and then after that, once that activity is gone, he don't want to play, he don't want to interact socially with his peers. And this is making me think about it, that maybe he could be suffering from selective mutism, right? But why would he suffer from selective mutism? Again, it comes from where? Parental alienation, where you have been alienated from social activities because you have been secluded, and the parent is trying to use you for their own gain, for their own selfish desires. And the normal aging process where you be placed in social settings with your age appropriate kids is not happening. All these things can trigger or can lead into situations like this. So I remember gone are the days, like, way back when I was dealing with that. I remember that this was one of the issues that came up in one of my kids' conferences. So this is bringing my mind back to it. And that is why I want to share this with you. I feel like there are many contributing factors, and who are the people that are supposed to help the situation as parents. Teachers need to know about it. Teachers don't. So eventually they will give tags like, oh, she's autistic, or he's autistic, or he's ADHD. But what do you call it? You know how ADHD, you have uh, the hyper and inattentive. So maybe he's just not paying attention, he's not focusing, he's looking away, that kind of thing. So teachers can misdiagnose, mislead, mislabel the child. But you as a parent, when these things are happening, what do? You take your child to a specialist, their pediatrician, and say, hey, this is what I'm observing, this is what the teachers are saying. What could it be? I just want the right evaluation done so my child is not misled. So I also can pay either for private services, whatever it is, to get my child the right need. So what are the signs of selective mutism? I'm going to read this from different places so that you see a different angle of it. So according to the DSM-5, right, it says that one of the signs of SM is that the child who is usually talkative at home, which is very common. The child that is talkative at home with families, friends, like in his or her normal habitat, he's comfortable there. He's not shy there, so he'll be talking and interactive. Soon as you take him out in the public space, You see somebody talking to them, they'll be looking down, they won't talk. Then the person will try to read their mind. Oh, is he always shy? Oh, she don't like talking much. So they make assumptions. So when you see this happening, follow up with your child. There are activities you can do to get your child to be more verbal, to be more was social. How do you call it? To be more, to get rid of the anxiety that comes with social exposures. Because if that is not taken care of, if the desire to talk, to not talk will increase, it will remain, it becomes permanent. And that's why we have to do this. Okay. So it says that when they are around family, when they are around friends, when they are in their normal habitat, they are able to talk. And then they'll be speaking two words with one syllable and alters or gestures in order to communicate. So sometimes they would use gestures. They will talk a lot. It's not like they are shy, but it's because of the diagnosis. So if you don't know to evaluate them, give them the right diagnosis and provide them the right help, then guess what happens? They won't grow out of it. If anybody tell you it's something that you grow out of, it's not true. You cannot grow out of it. You cope with it and you adjust. How do you do that? Sometimes you use medication. So the medication will get rid of the anxiety part. And then the behavior modification, which is cognitive behavior therapy, will get them to be more confident. So they will psych themselves. They will know how to cope. They will know that, okay, when somebody is talking to me, I have to look at them in the eyes. Meaning of eye contact, what the eye contact means, even culturally for an African versus culturally for an American. Americans believe in eye contact and handshakes, firm handshakes and eye contact. African necessarily might not. So how does that affect the child in the culture, in the society where they find themselves? Okay. Another sign is that a health professional must eliminate, this is the differential diagnosis process. So the health professional must eliminate the possibility that the child is unable to speak the language or doesn't have the knowledge about something he's asked about. So a person with a selective mutism, right, as a child, as a healthcare provider that is assessing this child, you ask yourself, is it a language barrier? The child just came from Africa. Is it that he's not understanding the fast way that Americans speak, or the people speak in Germany, or the people speak in Europe? Is that what it is? Or is that the topic they are discussing, they are not informed about it, so they don't know how to, they don't have the knowledge, the base to indulge in the conversation? Do they have the knowledge base, or is it that it's actually a problem? So now it's the healthcare provider's job to kind of do thorough assessment and assess, do you know what they are talking about? Like, you try to see if they understand the subject matter. If they can speak the dialect, they understand the language. If not, then okay, what else could be the issue? So these are the eliminating processes and how to try and arrive at the right diagnosis. The condition must be present for a minimum of a month. Remember, when it comes to diagnosing and the DSM-5, I have been stressing about duration. So they said that for you to diagnose a child with this situation, it must be persistent for at least a month. My dear, I feel like by the time you get to diagnose these kids, right, they've been there for years because it is mostly missed, whereby teachers mislabel the kid, teachers constantly bug you with notes about your child and try to make your life miserable, trying to tell you things that probably in the house you don't observe, and then that makes you to start questioning yourself, like questioning your child, and start to make you feel, when things happen like that, parents, don't be upset. Rather, take your time and start doing your own investigation. Be kind to the child. Ask questions. Find out what is going on. Try and take the child out a lot. Every child that is birthed, my friends, if you are listening to me and you are a young mother, or you are pregnant, or you are just about to start your family, the best way to go is not to have a child and leave the child in the house and go to work. Let that child from the very get-go invest in putting the child in an environment that stimulates them, that puts some structure in them, that exposes them to their age-appropriate children. When you do that, some of these things can be eliminated. But we Africans, I said, if I had to go back into time, you go and bring your mom here, you go and bring your family member here. They're supposed to, kind of help you in the house with the kids all the way till they are 5 years old. When that Obodo Ibo child is already in daycare from the age of 6 months, and your child is going to compete first time in the social environment at the age of 5 with Obodo Ibo child that has been in social environment and structured environments since the age of 6 months or 6 weeks old. It's very, very important and crucial, okay, that we know these things, our actions affect our children. And that is why I do this kind of psychoeducation. So you know for yourself, and also in instances where this affects children also, you know how to take the interventions to take to not let this happen. If you're a grandmother, hey, like us now, me, I know better now. So I'm going to be supportive of my kids, their wife, their kids, so that the things that happen to us due to trauma and parental alienation don't end up happening to my grandkids. And with time, you rechange the story, you relabel, rename the story. Okay. A determination will be made if the condition is causing negative impact on school and other activities. And you know this will cause a huge amount of negative impact in the academics because there's a lot of projects they do as a group. She won't be able to engage fully. They will not be able to give him grades that he should get because in some instances, if we do group activities all the way to the university level, even at the master's level, I did some. You have group projects. And sometimes you do it and you have people that don't want to do it, but they want to have the same grade. Meanwhile, there's a Google Doc open and everybody go in and edit their portion. And some don't do it and they'll send you emails backstage, oh, do this, or do that. And then you end up doing the whole work and others get graded for it, scores for it. It will affect a child because if the child don't learn how to engage socially, how to communicate, how to feel confident in a social setting with his peers in school, to question, oh, how do we do it? Who you hold this? Teamwork. Hold this, I hold this, let's do it. This can affect them lifelong. A child can grow up with selective mutism and can become a depressed adult. You know why? They have lacked the ability to face the world, to face life, to deal with the world. So as an adult, they are working in an environment where they can't even engage. How does a child with dyslexia become evaluated? Evaluated. You mean, I know what you mean. Would it fit in your topic? Yes, a child in dyslexia, with that kind of, dyslexia condition, dyslexic, if the child that is dyslexic, you can assume they are dyslexic, just like you can assume a child have mutism. Most of the time in the schools, they will say the child have high functioning autism or low functioning autism just because they are not talking. They like to go straight to the autism spectrums. They like to go to the ADHD. So your job as a parent is the process I'm talking about. Get the child evaluated by a neuroscientist, a neuropsychologist. In Maryland, you can go to the Kennedy Krieger Institute. You can go to John Hopkins, but mainly the Kennedy Krieger Institute have different departments. It's a neuroscience institution where they have the autism spectrum division. They have the trauma. They have trauma unit, which I've been trying to enroll my kids in the trauma unit for a while now, but the waiting list is huge, especially with the distance. I just feel like they have gone through therapy with everything we've endured, but they have not really had the trauma focused kind of counseling. And I feel like it's normal for them to have it. And then don't feel shy that you're gonna have it. You saw what people did to Cora, that they are telling Cora, oh, Cora, because you feel you have a situation and you need that talk therapy, it doesn't mean you have mental illness. You go and talk to somebody and it's the same situation. People don't like talking about it because when they talk about it, people judge them. You see, something like this I just share with you. You go to Facebook, you share that there, and they take screen recording. They want to use you on their platform to build their pages. And that is why we as society, or we as people of color, we are behind. So yes, this being dyslexic is definitely affiliated with all these childhood conditions. But how do you even know the child is dyslexic? You have to take the child to a pediatrician, get a referral, share your concerns. This assessment takes series. It's not one day assessment in majority of the instances. They require follow-ups. They go if you go to Kennedy Krieger, you come in, you do the intake assessment from different people. Finally, you get to meet with the doctors, the specialized doctor. Excuse me, if it's autism specialist, if it's what. Then they bring you in, they evaluate you. They have different tools they use to evaluate you. Based on these tools, they now book another appointment to review your result with you. What they do is they go and analyze your report, your findings, what you put on the assessments, scales they gave you. They now go and look at them, analyze them, and then bring you back in and review the result with you. Then at that point, they form a diagnosis with you. You understand? So if you think the diagnosis is not appropriate, you can also seek clarification and say, no, I disagree with this kind of diagnosis. I feel like this, I feel like that. You see that? Good evening, good evening. See what I'm saying? Okay, so it says that the health professional must rule out other disorders, including stuttering. You know, some people stutter, some people stammerers. So because I'm a stammerer and I don't want people to notice I'm shy and I'm not nervous about talking, doing it all. So I'll just be quiet and look down or act like I'm shy. And this can be something that people will look on and think that, oh, I have something else, when in fact it's just that I have selective mutism. You understand? So it's important that you seek the professional attention, not just assume and not just those teachers in school. Please, if I say I can't stand them, don't take it personal. They can perpetrate mislabeling of your child, and that affects your child from getting the right care and services. If you have the ability to pay for private service for your child, kindly do that, because you know what, that can go a long way to resolve the situation and depending on the system. Remember, the system is not for you. The system is not your best friend. For each child that they put on IEP, that school gets at least $20,000 or more a year in the academic year. So just pay attention to that. How much service are they getting? If you even have that $20,000 and you pay private service for the whole year, you will not pay that much money. But that much alone is paid to the school, and your child don't still get the best, if you ask me. All right. This is what a determination. Okay. The condition must be present for at least a month. A determination will be made if the condition is causing a negative impact on school or other activities. And we know for you to be able to have a specific diagnosis like that, you have to be able to prove that as a result of this behavior, it's affecting you significantly in your academic performance. It's affecting you significantly in school. You are breaking down. Because of that, you have anxiety, you have depression, and as a result, sometimes the child don't want to go to school. So when a child feel distressed about having to go to school and still face their fears, then it is what debilitating, and you need to take actions. Okay. They are not able to go to form healthy social relationships, go out and engage and have friends. You know that it's a problem, because every child, normal child, want to go out and have a friend. When they don't want to go out, they don't want to engage, then it's a problem that needs to be looked into. Okay. The health professional must be what? Must rule out other disorders, including stuttering. Okay, we talk about that. And or the lack of verbal communication during psychotic episode or psychotic disorders. Okay, he is, some people with psychiatric conditions, they also have the behavior where they don't talk and stuff like that. So they have to be able to rule out, is it that they have a disorder? Is it that they have mutism? Is it that it can be because the symptoms they present, right? It's also seen across board on a lot of conditions. So it is always missed and it needs dedication and thorough assessment and you being very attentive to your child, because remember, you are the primary advocate between you and these people. This is your child, this is you, and this is everybody else, all the systems here. So how do your child get the right diagnosis and the right care? You being the first person observing, assessing, and saying, no, I think it's this, no, I think it's that, no, my child is having, I see this a lot, what do you think? So when the school start labeling the child, calling you and writing all those horrible reports, you know how to jump on the wagon and say no. Because if you are some of the tags, if you allow them, it only limits what your child is taught in school. Understand, in the school system, we have the GT students, they are gifted and talented, or the people who take advanced courses. We have the grade level kids, and we have those that are this. You think, oh, my child is in 7th grade. Don't be misled. Your children is not learning the same thing everybody else is learning. So you are the only one that can advocate the right way for your child. How do you advocate when you don't know? That is why Empower Wise comes here to teach. So you get to know. Okay. He is extremely attached to parents. Yes, you take your child out, that he or she clings to you, holds on to you, don't leave. Whenever you get to a party, instead of the child leave you and go, the child stays with you and holds you. And when he has to go, then he has to cry, or he will be sweaty or stuff like that. You need to pay attention. He has emotional outbursts. Child have emotional outbursts. These are some of the signs. Okay. Signs of selective mutism. So signs that a child doesn't have selective mutism. These are signs. We've talked about some signs. Let me see something else before we go into that. Signs, let me read another. I'm reading from another platform. Let's see what that one says. Signs of selective mutism is talking freely at home, but becoming completely or mostly non-verbal at school or around strangers. Inability to speak even to familiar adults, such as parents, in the presence of others. Pay attention. In the presence of others, a child with SM will still not feel confident in talking to you, even the parents. And it will be looked at, oh, is he shy? It is no. You need to pay attention to this symptoms and start your interventions early. Know the signs and start intervening for them early. Difficulty talking with peers in school, very common. Difficulties talking with peers. Seeming shut down or paralyzed in social situations. Yes, they feel like they have lost their power. They feel like they have been disabled, and they feel like, you know how paralysis is like, they are totally shut off, and they are looked as awkward kids by their peers, because why don't she always talk? Why don't he do this? Why don't this? Why don't that? So now he becomes somebody that other kids will pick on, because they don't understand, they don't know. The child now begin to feel like she's being bullied, he's being picked on, and as a result, it affects their confidence, their self-esteem, their ability to grow as normal kids and go out there, blossom, and build strong confidence and self-esteem. Okay, because they are always thinking about, it's cognitively, they are always thinking some people is talking about them, some people don't understand them, some people, and they feel scared and anxious to get out there and talk and engage. That's the difficult part. The waiting list. Yes, the waiting list is terrible. I'll be honest with you. It's terrible. So you knowing early and try and get the kids on different waiting lists. If these providers are not available, find a different provider and put them on different multiple waiting lists. And also make sure you are getting not just the school's opinion, private pay for thorough investigative assessment to be done. I don't trust the school system. Yes, I don't. Unfortunately, um, don't be dependent on the school system. They will do anything to get the grants for their schools. Even if you want to put your child on therapy, get counseling, get them outside counseling. Don't put them on the school counseling. They can be on the school counseling if it needs be, but always have a private service for you. Use their insurance or pay it out of pocket. So seeming shut down or paralyzed, we talk about that. Using gestures, facial expressions, and nodding in place of verbal communication. I've seen that a lot when my kids were going to parental alienation. You talk to them, and I'm saying, use your words, use your words. I'm telling you, it's, isolating your kids, psychologically grooming them under troops, parental alienation, psychologically manipulating them is a dangerous thing for you to do. It doesn't help any child. It doesn't. I talk to you from a place of, as a clinician, as an expert. This is what I do for a living. And I also talk to you from somebody who has endured some of these things. Okay. All right. So they use gesture, they don't use their words and stuff. Dispelling the myth. Okay. Let's go back to the other article. Okay. So now that we get the signs out of the way, let's look at the signs that your child doesn't have autism. I say autism, SM, selective mutism. A child may display other signs that do not indicate that they have selective mutism. And this include what? The child that has never talked in any situation or environment. You know how you have some autistic kids and they don't talk, or you have there's this other condition that the child will be talking and doing everything normally, and then after when we get to childhood disorders, I'll go into that, obviously. But when they get to 18 months to 24 years, then they digress. You understand? Like I said, there is so many childhood mental health disorders out there. And that is why it's important that you see a specialist for them to do thorough assessment and provide and using the differential diagnosis process to eliminate, is it this, is it that, and let them come to arrive at the accurate diagnosis. Without the accurate diagnosis, the right care will not be initiated. Sometimes they want to give a label quickly, and certain people have trouble with that, especially here in the Netherlands. It's not just the Netherlands, Miss Connie. It's here too. It's here too. And that's why I'm passionate when I said the system is not for you, it's real. And especially when they get to know that there's a battle in the background, there's fuse, parental alienation, there's divorce, parents are not getting along in the background, they are quick to label your children. And you are the primary advocate. You are the primary shield between you and them. Them is the system right here. And you are here, right there. Everybody else is here. You are the parent that's supposed to advocate for your children. If you don't, no one else will, people. If you don't, no one else will. All right. He has never, if the child has never talked in any situation and environment, understand that in selective mutism, the child should have been talking in the house, comfortable around parents, comfortable in his natural habitat. However, when they meet strangers, when they go to school, in group activities, when they go even in public spaces where they are present there with you, the parent, they don't want to engage with others. Even if you ask them questions, they shy away, they shut down, and they don't want to talk. That is a sign of selective mutism. Versus a child that has never talked at all in any situation. That can be associated with like autistic, with autism, we have classes, categories of autism. Once a child is labeled, it follows them throughout their life, their school career, everything they do, it follows them throughout, people. It follows them. And that is why I'm very concerned. Let them get the label to get the support if they need it. But if they don't need it, you can fight it. And majority of the time, your provision of the right services can eliminate it. You have a child that grew up in Africa, you brought them, and then you have a child that is in the house, you give birth to them here, but the child is growing and they are learning the home dialect in the school, in the English language. That those children that have multiple dialects languages growing up, they get picked on as early and labeled because they are in school, they are talking, they understand what is going on. However, when they want to talk, they miss the language. They can reply with the English language questions from the teachers with their dialect. And the teachers pick that as a child that have a dyslexia, whatever. They start labeling the child. The child is hyperactive, the child is this, the child is that. So it is your job, and that's why we are here. It is good evening, good evening. It is your job. It is your job. Hello. It is your job, okay, to make sure you are there as a primary shield for your children. Also, a sign that your child doesn't have selective mutism is that he or she has just recently been introduced to the language in a particular environment. I just said that, it is estimated that it takes up to half a year to become comfortable with the language. Yes, when the child migrates from Africa, come to the West, they said it takes up to 6 months. So why would anybody want to label them because they have multiple languages and they need to transition, they need to assimilate. Another thing is the child is giving birth here. They have different languages in the home. Now they are introduced to the school environment. Like they said, it takes up to 6 months. But then they are quick to judge. They are quick to start harassing parents and tell you your child is this, your child is that. It is your job. Again, it is my job to bring you this awareness. It is your job to pay attention and advocate for your child. No, it's not true. Just because my child is a multi-language speaker doesn't put the child as place the child in a situation where he or she should be labeled. But what is if a child stop talking because of a trauma? What do they diagnose them with? When a child start talking because of trauma, we cannot just say that they have selective mutism. And I also can tell you directly right now that this is what they get diagnosed with. Let me tell you something. I worked in the corrections for a very, very long time. And you have grown-ups that chooses not to talk. They speak all their life. Why? Because you know how they tell you you have the right to talk but not to talk. But remember, everything you say will be used against you. So you see these adults in the correctional institutions that choose not to talk because of the fear of what they say will be used against them. And they live for years. If I talk about they live for years, decades without talking, that is for real. Adults, they live for years without talking. So the same way with trauma. Trauma is something that shuts you down as a result of a shock. Look at what happened to Cora's body when the shock happened. Her breast milk shut down, her body, it shuts you down. So trauma can be, so in this case, I don't know this, like I said, I don't know the exact diagnosis because you have to really assess the person as a whole. But definitely mutism can be awarded or assigned to that, but understand that we have in the DSM-5 what type: trauma related, trauma initiated, severe, moderate, mild. So this is how we diagnose. So definitely if they have mutism and it's real and they are not talking, yes, they are not talking. So they will have the mutism, but which type of mutism and what is the specifier? That is what we should be talking about. So yes, that is something to get evaluated for, and that is when they will go to the DSM-5 and assess, give you the necessary tools that will be they will help them to draw a conclusion. Okay, who knows their child better? It's the parent. It's the parent, and that is why I'm saying this. So you are the person that has to know to be there to advocate for your child. No one else will. Yeah. So Miss Kani, I hope I answered your question. The person will definitely have the mutism or this diagnosis, but what specifier? The specifier comes in after a thorough assessment and thorough evaluation is done by the provider. If they have mutism, they have mutism. If they are not talking, they are not talking. Why are they not talking? Those are the things that will be assessed to be able to come into a definitive conclusion and give them the specifier. Like you have anxiety. What type of anxiety do you have? Severe, acute, chronic? You know what I mean? It all can boils down to the magnitude and the duration. And if you are stable medication, a lot of factors comes into play. Okay. So it says that it is estimated that it takes 6 months. We read about that. When a child is learning a second language, he may go through silent period until he becomes confident with speaking the language. So that is not a sign that they have mutism. Okay. The mutism occurred abruptly in every environment after a trauma event. Miss, this is your listen. This is your question, Miss Canning. It says that the mutism occurred abruptly in every environment after a trauma event. So who knows? They may say the person have mutism, but they may not award it as a diagnosis according to trauma, what they are saying. So if it depends really. It depends on the holistic assessment that will be done to award this diagnosis to the child or to the person, to the individual. You understand? So those in the corrections I'm talking about, they necessarily are not awarded the diagnosis of mutism, but they do acknowledge that they have mutism. It's a choice. They made a choice to not talk because of their trauma, because of being scared that whatever they said, because of their probation officers telling them what you say will be used against you, or their lawyer telling them what to say said will be used against you. So they choose not to talk. And for years it becomes, and it can be serious because sometimes you have people living 2 years, we're talking about 10 years, 20 years, and never open their mouth to talk. But they understand life. They know everything you say. Who knows? Yeah. Okay. I've seen it before that that child didn't talk for years, but I get it now. Yep. You see that? So it's us really, in such an instance, seeking help, seeking care immediately, early, identifying it. Early identification is key here. Hi, Ms. Beckins. Once a child is diagnosed with a learning disability, is medication prescribed, you mean? When the child understand that learning disability is nothing you should be treating a child with medication for. It's therapy. And especially if they have ADHD, no, what's the name? Autism spectrum, and you use, is it ADB? They have a specific therapy treatment. And most of the time they will use CBT. So this is the thing. When it comes to these learning disabilities, right, or behavior issues, majority of the time, what the primary treatment is therapy, cognitive behavior therapy. So the cognition, the therapist will go into getting into the brain of the child or the individual, find out what could be possibly causing this whole situation. Why is the person behaving the way they are behaving? Why did you do what you did? Okay. And now, so why could you have done it a different way? What made you do that? How did you feel when you did that? You see that? So specific questions from this specialist triggers response after response after response. As a result, now they have to train the child or train the individual of replacement behaviors. What can you do should this happen again in the future? What should you do? What should the child do? So and then they will also help you understand the implications, the consequences of your behavior. So what do you think you could do differently? So they poke you, how do you call it? They poke you with the questions so you can critically think and kind of identify yourself, like, this is what I did. Your therapist is not judging you. However, I'm trying to really help you to understand the impact of what you did. the significance of what you did, how it affects everybody else, how it affects you, and what can be done to change the situation. Yes, yes, yes. Thanks for being here. It's better later than never. Yes, prescribed. Yes. Oh, yeah, I know what you mean, Miss Linda. So, no, when the child have learning disability, the first go-to pain is not medication. When the child have all these behaviors, the first go-to place is not medication. It is when anger, anxiety, depression now becomes part of the problem and it's affecting their ability to function. Now we are going to go, somebody with hyperactive and stuff, we are going to go to medication to help control the anger, the anxiety, the depression, so that when you are in therapy, you can engage and make and gain from the lessons that they are teaching you, from the mental retraining, cognitive retraining skills they are giving you, the coaching they are giving you, the life, the alternative, the unlearning and the learning behaviors and instances. But in this instance, you're going to unlearn behaviors and you're going to learn replacement behaviors. You see how it goes? Yes. So the first go-to place treatment is not medication, but we're going to get to treatment and we're going to see what they said about that. Yeah, you're late, but you're here. That's what matters. Hi, Miss Marcia. How about learning and anxiety in medication helpful? How about learning and anxiety is medication helpful? Yes, medication is helpful, but like I said, the first go-to place is not the medication. The medication comes into play when it's that bad and you can't focus, your attention can't, you can't concentrate. Then now we have to give you, if it's something that you need to remain focused, they may give you stimulant. If it's something that need to control your anxiety, they may give you SSIRs, like antidepressants, which are also anti-anxiety medications, to calm the anxiety down so that you can even learn and unlearn the behaviors. So yes, they go hand in hand. The first treatment to go to is therapy, cognitive behavior therapy, behavior modification therapy, anxiety reducing coping skills. They teach you all of that. But when it's that bad and it's debilitating, and even you can't sit still to even listen and learn this and unlearn things, that is when they give you medication. At this point, research has proved that medication and therapy together is most effective treatment. The number one primary go-to is what? CBT, therapy, cognitive behavior therapy or psychotherapy. But if it's debilitating, then yes, 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 medications are added. So first they start with therapy. They don't, in medicine, you go from the least invasive and least harmful to the bigger treatment. So it's always started with, every treatment starts with the least harmful treatment, which is therapy in these instances. Yeah, really enjoying this topic. Thank you. You see how it goes. Thank you, Miss Holland. You see how it goes. Okay. So the mutism occurred abruptly. We talk about that in every environment after a traumatic event. Imagine you have a child that has been exposed to a violent person, an uncle, a church leader, somebody that has taken advantage of their virginity, a child, a young girl, right? That child can end up having a symptom that looks like mutism. When they see that person out of anxiety, they'll be scared, they'll be, and it will seem like they are mute. However, oh, thank you, Miss Cole has showed her presence, people. Thank you, Miss Cole, for the 10 euros or 10 pounds. Which one is that? I don't even know the size anymore. Please, we are also monetized here on YouTube. Kindly support the channel if you don't mind. Share the videos out. No, I forgot to even share the link to Facebook for people to join. Share the video out and let somebody join it. Share to your WhatsApp groups and let somebody benefit from it. You can send us support as you desire to. What's in the middle? Oh, let me. And understand that we are monetized. So over here, if you and like the video for me, I would greatly appreciate that. Join us on YouTube. You understand? So yeah, you can support the channel here as well as just like you send stars on Facebook and do the same here. Okay, so here we go. Is there treatment for selective mutism? Yes, there is. So anyway, I think let's read this. Sometimes other speech difficulties like stammering are present. We said that already. You see how it goes. You see, so yes, share the video, people. Share the video so somebody will benefit from it. Please, what is the topic? We're talking about selective mutism. Selective mutism is a childhood mental health disorder that is present in kids, whereby you see them in their homes, in their normal habitats. They talk. They are very interactive. They don't feel anxious talking to people. But then when they end up finding themselves in schools, they are not comfortable talking. They keep to themselves. When you ask them questions, they choose not to talk. They are not open socially. They are affected. They can't form relationships. When you, even in some instances, when you take them out as a parent and they see strangers, they cling to you. They stay next to you, almost like they have attachment disorder, yet they don't. And then they don't want to talk to people, then they look down. So we're talking about selective mutism and how it affects the kids, and in the school environment, how you have parent-teacher conferences and your kids will be mislabeled because of these things. The teachers have lacked knowledge on how to assess, pay attention, evaluate. They're supposed to be protecting your kids by observing them and helping them the right way, but rather they become judgmental. They rush to the labels because of the benefit it provides to the school, because of the thousands of dollars and euros that the pounds that the schools get. So what we're doing today is to help you identify the symptoms of selective mutism. What is selective mutism? What is not? We just went through a whole bunch of instances where your child is said to not. If a child that went to trauma, see their victimizer, their abuser, perpetrator, and don't want to talk and feel nervous and stay back, it doesn't mean they have mutism. A child that has never ever talked before at all, they don't have mutism. You have to go and assess them and find out what diagnosis could best fit them versus this what we are talking about, selective mutism. In selective mutism, they must have been talking. They must feel comfortable talking to their parents, their siblings in their homes before coming out. And then when they go out, it becomes a problem. The ability to engage is hindered. Yes, to a point that is very. Oh yeah, yes. You click on the dollar sign on the page, and then you see it to give to support the channel. Where you think where you click the to type. Oh, you guys are just interacting. Okay, yeah. Press okay. Let me leave that alone. We need to. Okay, I see what is going on. Yeah, Miss Cole can guide you to where you can donate to support the channel. The mutism occurred abruptly in every environment after a traumatic event, like I was explaining. If it happened like that, it doesn't mean the child have mutism. So adequate assessment. Thank you so much, Miss Linda Beckins, for your support. So adequate assessment is very crucial for the child to have what? To be diagnosed appropriately. Understand, I keep stressing on differential diagnosis. Having the appropriate diagnosis is very crucial to having the right care, the right treatment. Okay, so this is very important. Is there treatment for selective mutism? Let's see what the people said. researchers and the DSM-5 direct us to do. When the child with selective mutism is diagnosed early and has a treatment plan in place, the better the progress or the prognosis. Yes, you know that. Oh, thank you, everybody. So the sooner, it's very important that you get to identify these things early, and you get to diagnose it early, and you get to seek treatment early. It's like you have identified a cell, a cyst. I told you guys I had a cyst removed. If you have dermoid cyst, it's a cyst that can make you lose your ovaries, lose your womb. It can get to a point where nobody will know you have it. The only time you get to have it becomes a problem is when it ties the tube, and then it occludes and prevents circulation and blood moving from one end to other. You end up in acute, severe pain. You go to the hospital, you end up having emergency surgery. At that point, you're going to lose your ovaries. But in my case, I went to do a lumbar MRI, and as a result, they found it. So guess what? They did a surgery last year, July, and they were able to preserve my ovaries. So even at my age, I can still give you babies. You see what I'm talking about? And that's just by the way. So I'm just saying that early diagnosis and early care, early services, early treatment result in good prognosis, good outcomes, good results, and your child can become a person that may have selective mutism but can live a healthy life. Thank you, Miss Cole. Can absolutely live a very healthy life, if you ask me. Okay. Early prognosis is for him to overcome the condition. Yes, because you want your child to be socially appropriate, to be socially confident, to go out there and be able to live a healthy life that supports their living. That makes them not to be limited. That makes them to not miss opportunities. You see a child, you can't even extend hand and greet people and shake hands and give eye contact and greet people with confidence. How does that affect the child? In an interview, you can meet somebody, you can say, "Oh, I don't have a job," and based on your confidence level, can attract the person to say, "Oh, I know a friend of mine's father have this job. I can link you to them." Confidence, socially appropriate behaviors can result in bringing those opportunities to you and your children. You understand? So it's very, very important that we learn these things. We know the science and we know how to help our kids. If a child isn't diagnosed until much later, that is in the teenage years or whatever, the mutism may become a conditioned response. You ask them something and then they cope by using their head to nod. They use gestures to respond to what they need. Good evening, good evening. They use gestures to respond to what they should be using their mouth to do. That's why it's important to engage these kids very early, very, very early on. Okay, people. That's how it goes. Thank you, Miss Linda and Miss Cole, for the support. You see, cognitive behavior therapy may help the child identify the thoughts that make him anxious. See what I was explaining earlier. Cognitive behavior therapy just help they trigger you to think, to see the realities of your thinking, to see that it is alteration versus what altered thinking is and what realistic thinking is, and then what universal, what otherwise a normal thinking is. Okay. Thank you, Miss Cole, for the stars. Yes, on YouTube we have our own stars here too. Thank you, Miss Linda Beckins, for the stars. Yes, people. So you can do the same as Miss Linda and Miss Cole and support. Based on your support, you get to get your label, your badge. All right, people. Thank you so much for your support. All right. So cognitive behavior therapy may help the child identify the thoughts that makes them anxious as they relate it to their behavior. So what were you thinking that caused you to do this? So cognitively thinking what is going on. What were you thinking that caused you to behave the way you did? What were you thinking? How does it make you feel when people ask you questions? How do you feel when they ask you questions? Well, I feel uneasy, I feel scared, I feel shy or something. Then now they will tell you, well, you don't have to feel shy, or they will tell you replacement activities, what you could do to not feel that way. So all this comes into play in therapy. They teach you, they first dig into the brain to identify and find out. As a result, and then the assessment process, at the end of the day, they develop a treatment plan for the child or for the adult or for whoever it is. But it's I understand that the earlier in the foundational phases, if it's identified, the measures will be taken to help the child so it doesn't become a chronic issue. It may remain throughout their life. However, they will change their approach, they can cope better. Why do you have people with disability that go all the way to the university? I'm telling you, a lot of doctors have ADHD, yet they are psychiatrists, and they are one of the best psychiatrists out there to have, psychotherapists out there to have, psychologists out there to have. And it's real. We have a lot of people like that. Think about it. They didn't act like us Africans and sit down there and not provide services for their kids. They expose them. They try to make sure that they are not limited. There's a guy on social media, YouTube that I keep on telling you guys about, the Clements, a guy with 35 or so, now she'll be probably 36, and got married to this 23-year-old girl. And the guy is have disability, and they had a child, and their child have a disability, and not a disability that is necessarily affecting the brain. It's a disability that has affected the physical feature structure of the child. And in that case, their child one is infantile, like the bone is very fragile and it breaks easily, brittle bones, and they always have to be doing surgery. But the fact is, they are not planning to limit that child. So far, the child has been a healthy baby, nothing else yet. So that is awful, and that is wonderful, awesome, right? So they are not planning to limit. The father is sitting in wheelchair. This is the father's height. This is the father's height. And the mother is taller than me and big, maybe 2 times my size. And they have a child. Over the past 3 years, they met, they engaged, they got married, and they had a child. And they are living a healthy, normal couple life, like a normal couple will. You understand? But it's because they are not limiting. The parents of the man didn't limit him. As a result, they are planning and he has clients. He talks to corporate organizations. He does shows. He stays in the comfort of his home, prepares talk shows like how you have Steve Harvey and other people, Oprah Winfrey. They are not talk shows like motivational speaker and talks. You know how you talk about like me like this. I would love to do what I'm doing, maybe on a professional level one day when I'm free and I can learn more into it, right? More about it, and teach about parental alienation and teach about behaviors and teach about how parents can take charge of their kids' life from the very get-go. You understand? So, this man, if you guys know them, look them up on YouTube. The Clements. Miss Linda probably would know them. The Clements. I watch them. Great. I know Miss Linda will know them. It's an inspiration to me if you ask me, because the man has a normal job that he is the breadwinner of his home. You think that happened by chance? No. That happened by somebody making efforts to invest into that child's foundation. And a child like that would have had multiple hospital stays, multiple admissions, inpatient stays. But regardless, it didn't limit him in attaining a professional career, a degree, and living his life as a normal person will. In that home we're talking about, ask Miss Linda. He is the driver. He has a car. Thank you so much, Miss Cole. Again, he has a car. His car has this disability chair. He is the one that controls everything in that home. I mean, if I say everything, I don't mean like that, but I mean like a man should. He drives when they are going out. The woman never drove. If I'm lying, Miss Linda will tell you. But Where did it start from? Somebody doing that investment in that child's foundation. Okay. So they work with you on the negative thought. The child will work with the therapist to replace the negative thoughts he has with the positive ones. You see what I'm saying? They first probe into why. Why is the behavior? Why, what were you thinking? And all that. They now try to correct the perception, the alteration in concept. Okay, so now we're going to replace this altered or negative thoughts with the positive ones. As a result of putting the positive thoughts in place, it positively affect the behavior. So now the child will face their fears. Remember when we did social phobias? Now they face their fears. Now we will go out. We're going to practice. Okay. So when we go out, you meet somebody, just say hi, hello. Just greet people, and that can be even a practice for the day. Hi, Annie. Thanks for being here. Thanks to have you. I'm glad to have you here. See what I'm saying? So the child learns to undo, learn exposure therapy, learn to go out with a parent, activities. So you do activities with them whereby it stimulates them to interact and be communicative. Activities that are in the school, they're going to be in group activities. So in the house, you take turns, you do a group activity as a family. See how it can help. Yeah, it can help. Okay. It can help a lot. Because selective mutism is connected to social anxiety disorder. Voila, I just said that already. And social phobia. See, I didn't even read on, but you see, social phobia, social anxiety disorder, doctors may prescribe antidepressants and anti-anxiety medications. It is believed that these anxieties are because of an what imbalance of chemicals in the brain, which is true, particularly the neurotransmitters or neurotransmitter called serotonin. You understand that? Yes, Miss Linda is talking about the Clement. Clement is what's his name? What's his name again? I forgot. Miss Linda, I forgot his name. For some reason, why is it the name even not coming? But yes, that is what he is. He's very smart guy, and he takes charge. He has a charisma that you can tell he has authority. Even though he's like this, he's a person with esteem, with dignity, if you call it. He has a good esteem, you know. So you understand. So therapy is number one, go to CBT and medication management. That is number one things you do to treat selective mutism. So I've finished today. The topic is pretty straightforward, but now let's go into another platform and let's see what they said when it comes to the treatments. They have a little bit more extensive things there, but pretty much that is it. Okay, but let's look into this. Okay. What is selective mutism? I think we have fair understanding of that. Science, we talk about the science already. Dispelling the myths. I don't think we should go into that. Treatment, that's what I want to go into on this article. So treatment, okay. Treatment, it says that the good news is that selective mutism is very treatable with the right care. Kids with SM respond best to behavior therapy. We've addressed that. That is focused on helping them learn to speak in new settings. You understand? Because that's really the issue. Why would somebody not talk in a new setting? They have anxiety, they have social phobia, social anxiety disorders, and all those fears that comes with it, and all those changes in neurotransmitters, epinephrine, norepinephrine, and stuff like that comes with it. I don't do good with names as well, but I'll share their YouTube name page soon. Yeah, no, don't share it here. It's called The Clements. Just go, you'll see it. It's called The Clements. That's the name of the page. Okay, and yes, I love them so much. I don't mind marketing their page. They have within less than a year, they got over 100,000 followers because their story is inspirational. Subscribers, I mean, now they are getting to 200,000, all in less than 2 years. That is focused on helping them learn, cognitive behavior therapy. That is focused on helping them to learn how to speak. doing new activities and with new people. If you are concerned that your child might have SM, you should get a comprehensive evaluation. I can't stress that enough. Don't focus on the schools. Don't let the schools seclude you and make you feel worried so much, feel anxious about your child. Get the right therapist, not the therapist, evaluation. Go to seek a professional, a second opinion. I will always do that. Go and seek a second opinion. Okay. The evaluation should specifically examine the circumstances in which your child is verbal and non-verbal. Because understand that they told you that if a child may not be verbal because of they have traumatic history, that is not necessarily what this is talking about. So, selective mutism is about. That is not, it's totally different. So they will evaluate specific situations regarding when the child talks, when the child don't talk. Does the child talk normally? Is it that when does he talk? Is it what setting and which setting does the child not talk? Those are the things they will do very thorough assessment and come up with the appropriate diagnosis for your child. And if she might have any co-occurring conditions, differential diagnosis, right? Co-occurring, so they will try and strike it. If it's anxiety, what type of anxiety? They will do all that. An evaluation will also rule out other diagnoses such as what communication and language disorders. That is when the learning, Miss Kani, that's when the learning disability comes in. The learning and language deficit issues comes in. So they will strike and see, is it that they have language problem? Is it that they have communication problem? Is it that they don't understand the concept that is being presented to them? What is causing the situation? That's the thing to look into, which could also be causing restricted speech. Yep. Finding the right treatment team is very, very important. Don't depend on the school. The schools, what I see is they are quick to label, but they provide substandard care after the label. They are quick to label to get the money and get the tax on your child that leads and follows your child throughout their lifetime. However, they are the worst when it comes to providing the right services for your child. Right services comes from you. Get the right evaluation, get a second opinion, and get the right care for your child. Okay. Treatment that moves into real world. For a treatment program to be effective, kids need to learn how to speak in everyday situation, not just in the doctor's office. This means that clinicians should model treatment around real life settings and situations. For example, because kids with SM typically struggle to speak at school, the Brave Bodies group program takes place in what? In a stimulated classroom and allows a typical school day and follows a typical school day with activities like the morning meeting, show and tell, and snack time. So this is just it's telling you a program that is used in treating selective mutism. The program name is the Brave Bodies. Okay, this helps children bring the speaking skills they are developing with them. And this is pretty much what I'm talking about, that you take your kids to the daycare instead of keeping them at home till they are 5 years old and you take them to school. Even if your mom and your father and your sibling, whatever, is brought to the West to help you support, take care of your children whilst you work, truth be told, I will tell you this. There are half-day programs that you can take your kids to, 2 hours a day, 4 hours a day, whereby they are in a structured environment learning with their developmentally age-appropriate group. A child that has had that exposure at the age of 6 weeks to all the way to 5 years can be compared to a child that is going to school at the age of 5. He's going to learn skills that these people already learned. So when they go there, they are now going to put those kids that are already in the system to regular classrooms, and then they bring your child to a limited classroom, providing them with substandard care and trying to help them to develop these skills that they are lacking first. We are the cause of our kids' failures. Parents, let's change our narrative. Let's own it and do better by our children. Okay. Learning to deal with anxiety. We have learned that. We've been talking about that a whole lot extensively here. So you learn how to do it. Oh, hi, Miss Tanya. How are you? Yes, we're talking about mutism, selective mutism in children. Okay. Practice the key. So we spoke about that, learning to deal with anxiety. They're going to learn skills that will help them deal with their fears. Okay. Then practice is key. Yes, as they learn these things, they are going to practice. They are going to, like I said, you as a parent, you can take them out, take them to a shopping mall, and let them just say hello to a child. Take them to the playground and coach them, prepare, follow the treatment plan that you and the clinician establish for the child, and practice, practice, practice with the child at home. Have a setup activity. You take turns, you interact, you engage, and express yourselves. Why do you think this? So when they go to school and they are exposed to such activities, they get to know that, oh, okay, this is what my mom was doing with me. So it becomes like a second nature. It's not so, it doesn't initiate that extreme anxiety anymore. It becomes like something that is normal. Because, oh, mom does it with me at home, dad does it with me at home. Oh, me and my brother were doing this the other day. It becomes part of them naturally. Okay. Working with the school, yes, it's a very important. It is a team. To get your child to be successful, it's a team. So while the teachers come and tell you all these stories, what you need to do go and seek second opinion. Get your child evaluated. After you evaluate the child, and guess what you do next? Then you now go and get help. Okay, understand that the denial, the fear, why me things will come into play. Oh my God, the negotiating phase and stuff. Thank you so much, Miss Tanya. God bless you for the YouTube stars, for the YouTube badges. Um, Thank you all so much for your support. You see what I'm saying? So the child does what? Let's read this one. Say that working with the school. As part of the comprehensive treatment plan, it is extremely important to get a child's school on board with treatment. Yes, the treatment team and you, the parent, and the child and the school are in a partnership to make this a success, to help your child to achieve and to attain success in this process. Okay. Often, I like YouTube because at least if somebody gives that, I can put their name up on the app, and it's great. It's helpful. If I eventually pay for this app, which is a lot of money, the watermark from StreamYard will be off. And then we can also stream to Facebook the same way. So if someone gives stars on Facebook, they put them up. Someone gives stars on YouTube, we put them up. Many educators, okay, often the first step in helping teachers and administrators at the school understand selective. The first step is, okay, so usually the first step is helping the school administrators and the teachers to understand what selective mutism is. When you go and seek your second opinion and your third opinion, and they bring a conclusion and it's really definitive that your child have selective mutism, make sure that you communicate that with the schools. Now the treatment plan will be communicated with the school. Now everybody will be on board, have a plan in place to help this child. So the child is not mislabeled, it's not picked on, it's not identified as somebody that have something else than what they really had, and actually take the right steps needed to resolve it or help them to have better prognosis, better outcomes. Many educators haven't heard of this disorder, and it's a fact. I said all they know is autism and ADHD. They are quick to put these tags because of the benefits the school gets as a result. Okay. And the child's silence can be mistaken for lack of comprehension, or ability, or stubbornness, or even positional behaviors. That is the sad part. That's why I keep telling you the system is not for you. And I don't trust the school system when it comes to these labels. Why I am telling you as a parent to take charge, take your child to full second and a third opinion. All right. April is here and Miss Gail is in class. Miss Gail is late, but hey, she's here. We're about to finish. Oh, we still have few. We're done with the class really, but now I just want us to go into the treatment a little bit, and that's what we are doing. Finding the right treatment team, we did that. Treatment that moves into real world. We talk about learning to deal with anxiety. We talk about that. Practice is key. Yes, we talk about that. Working with the school, very, very important. Okay. And like parents, teachers, and so you see what I'm saying? They will mislabel your child as a person that is stubborn. He's not comprehending what they are teaching. He doesn't have the ability to understand. And then most of the time, these kids don't have cognitive impairment. They don't have learning disability. They understand fully what is going on. They have good grades. But because of this, they learn and try to put tasks on them and try to limit them and try to provide them with substandard education. And that's why you need to know this so that you advocate for your child. What exactly does your child have? Why is the IEP? What is the IEP 7? Okay, take note of that. And like parents, teachers can adapt to a child's silence or get used to other children answering for her. That is another sign of selective mutism. You know, you'll be talking to a child that has selective mutism, right? And they won't talk, and everybody else will be answering for them. If you what's your name, other kids will answer for them. His name is Michael. What? So how old are you? Someone else there will answer for them. So this becomes normal for the child, for others to hop in and do the work for them, talk in their place for them. A child with selective mutism will have these symptoms. Aside them talking in their normal habitat with their parents, their siblings, feeling comfortable in those environments, and going to school and don't feel comfortable in talking, or facing social engagement and not being confident enough to talk. You also have this situation whereby they will not talk. So everybody else there answers for them. Like I'm standing here with my sibling. You ask me a question, I don't answer, but my sibling kept answering every single question a stranger asks me because I have selective mutism. That's one of the classic signs. And like parent, okay, we talk about that. Teachers should understand what selective mutism is and be trained in the skills and strategies that help kids with selective mutism to speak. Because it's not anything, it is the ability to be able to face their fears and speak, the anxiety and speak in every situation, not just speaking at home or speaking with people they feel comfortable with, speaking with everybody at large. Your child's clinician should be able to give specific advice on the best way to work with the school. Clinicians at the child, okay, so it's just mentioning different clinics. You say, so in IEP, understand this can result in an IEP for your child. Children with selective mutism may also qualify for accommodations in school, and that there's 504 plan or the IEP we've been talking all along, or be eligible for special school services. Would you want that? Me, I'll fight for it. I would say if it's just the selective mutism, make sure you don't have to put them on that special education. Special education plan is great, but what it does is that if the child is a high achiever, GT student, but they just have mutism, if they will put them in a specific group, you don't want that. So get a private service that works with a school. They may give the accommodation, it's not going to be so strong like the IEP is. Medication, we talk about it, right? The SSRIs. That will help with serotonin, will help with the anxiety, will help with balancing the neurotransmitters and the chemical imbalances in the brain. So eventually, you have a good life, you have a good health. Parents should expect to see results relatively quickly. from behavior therapy. If a child isn't improving after a month, parents should consult with a child and adolescent. Okay? Who can prescribe medication? Okay? Child and adolescent psychiatrists who can prescribe medication, or me, a psych nurse practitioner who can prescribe medication. If their behavior modification things put in place is not helping, do that. So that will help with reduction of the anxiety and help them to fully engage in their behavior modification active plans or in their cognitive behavior therapy sessions. That will help them to unlearn and learn the other behaviors, other positive traits. Okay, there we go. Most typically, a child and adolescent psychiatrist will use a type of antidepressant medication. Which one? SSIR. We talked about that already, so let's move on from this one. Types of help. Tips for helping kids talk. Tips for helping kids talk. Wait 5 seconds. They said, wait 5 seconds. We often don't give kids enough time to respond. Waiting 5 seconds without repeating the question or letting anyone answer for the child is a good rule of thumb. So what do? Practice, practice, practice. So if the child is in the house, you practice, you tell the siblings when they ask a question, nobody should answer for AJ. So we're gonna do this game, guys. We're gonna do this game activity. And then you turn it to a game, turn it to a family evening game, nice activity that will help everybody engage and interact. You take turns so that the child that have selective mutism get to learn how to take turns, get to learn how to respond and for himself. Why would you ask me if have you eaten lunch? Yeah, AJ ate this. Then somebody blip our answer. No, we're gonna learn to allow 5 seconds. That's what they said. Allow the child time to respond to questions. Okay, that's one tip of a rule of thumb to do. Use labeled phrases. No, labeled praises. Instead of just saying, great job, be specific. Great job telling us you want juice. Great job telling me how you feel. Great job telling me your shirt is dirty. Great job telling me you were hungry. Great job telling me. Great job asking. Wow, great job drawing that. Great, you know what I mean? So, well, drawing is not using their language, their words. So you have to be specific. Like, great job. They said, don't do that. Use specific language. Like, what exactly were they good at? What is the great job about? Use it. That helps to increase their confidence and help them to know that the more I use my words and I'm telling you something specific, the more I'm going to get reward. I'm going to get positive approval. I'm going to get positive reinforcement. And that is what is going to effect change. This way, kids know exactly what they are being praised for, and they feel motivated to keep doing it. Okay. I think this is probably the most part I wanted to get you to know. Rephrase your question. Instead of asking questions that can be answered with a yes or no, or more often modeling or shaking her head, ask a question that is, okay, so how are you? Are you okay? Okay, this is a typical example. Are you okay? No. A child with mutism will use their head quickly. So they said, don't do that. You don't ask questions that will require them to use gestures. Ask like open-ended questions that will prompt them to explain, be elaborative. Ask a question that is more likely to prompt a verbal response. Try giving them choices or her choices. Would you like a puppy sticker or a star sticker? So you see, they have choices to choose from. I like a star sticker. You see, then when they come, you know, some of the kids with selective mutism, even though you give them that choice, they're still going to come and point. A puppy sticker, a star sticker. They'll point. No, do you want this or do you want that? Use your words and you face them like you know how Cora does. Engage them at their age level, their eye level, and communicate with them at their eye level. All right. Hey. Hi, Miss Jai. How are you? You see that? What would we play next? what should we play next? You ask the child that question, they will tell you their desires, and that is going to prompt them to use their language. So you keep on teaching them. We say, okay, so it starts and extending to the school. The teachers have to be doing this module. Parents has to be doing this module. You're training the family, you're training the siblings, everybody, and that will go a long way. That practice becomes permanent, becomes next, second nature, becomes part of them. Practice echoing, practice echoing. Repeat or paraphrase what the child is saying. This is reinforcing and letting her know that she's been heard and understood. Did you say you want a cup of water? Did you say you want your plate? Did you say you want your book? What did you say you want again? So that is just to prompt them to repeat themselves and make them use their words. Okay. Be a what superstar. Yes, be a superstar. Do a play by play recap of what the child is doing. You are drawing a follower, or I see you are painting to the what? To the picture in the book. This helps convey interest in what? In what the child is doing. So pretty much it's a be a what? No, be a sportscaster. Be a sportscaster. So basically, the child is doing something, and then you are trying to reinforce what they are doing, trying to ask them, "Is that what you're doing?" So that they can use their words to tell you, "Oh, what is that? What are you doing? What is that? Also, what is this painting depicting? What does this painting mean? What were you trying to communicate in this painting?" That will prompt them to talk. I understand that this type also depends on the age. All right, helping older kids, bilingual children. I'm not sure if we should continue, but I don't want to make this long. But it would be nice. This is really, you see, the problem is I came from work, then I have not read this at all. If I read this, I would have gotten to this sooner than we did. But let's try and get into this part. But this is what I really want you parents to know. This is where the help is. Okay, helping older kids. Treating older kids with selective mutism is more complicated because they have lived with the disorder too long. Yes, but there is still excellent help available for them. Kids who have had SM for longer will be accustomed to not speaking in public. It's sad, sister. It's sad, brother. Try and get away with this situation if you can. And their parents, teachers, and other caregivers will have adapted to working around their avoidance. The kids avoid, and when they avoid, they don't want to talk. You ask a question, they walk away. You ask them a question, they look away. It becomes something that the teachers think, oh, that's her norm, that's their norm. It's hard. It will require a lot of retraining, changing the child. And then especially when they get to teenage years, when they are not willing to change and do anything different than what they are comfortable doing. They want to take the easy way out. It can be a challenge. Okay. To combat these long-standing habits, clinicians will need to put in place a very robust treatment plan, likely using intensive behavioral therapy. Clinicians may also go with children to the actual places where they have difficulty speaking in order to do real-life treatment. Not only that, real-life assessment too. For if you have a teenager that has this, trust me, more likely than not, the clinician, the therapist, the psychologist will have to go and sit in the classroom with the child. They have to arrange with the school to find out when they have a group activity, and they will go and sit at the back of the classroom to observe this child. And this is the same thing that happens when a child have IEP or something. They are trying to transition the child maybe to a higher level of care, of higher level functioning. Sometimes they come and sit in the classroom to observe the child for a long period of time, sometimes for a series of days. So you really want to do that for the person to have a better picture of what the whole situation is to better accord the right diagnosis. Kids who are older and have had a longer history of SM are also more likely to be what? Prescribed medication to help them participate in therapy. See what I'm saying? Mainly the medication is to help the kids ease their anxiety, their frustration, their anger, their anxiety so they can participate in the therapy, in the behavior modification sessions, in the undoing and the new replacement, undoing old, unhealthy, altered, or negative perception, and replacing them with the positive ones or more realistic ones. Finally, older kids with selective mutism are also more likely to have other diagnoses, other disorders, such as school phobia, social phobia, and other anxiety disorders or depression. Other disorders should be treated as well. Treatment for SM won't necessarily make sense because of what? Would necessarily make this problem go away. See what I'm saying? So the reason is when they get older, understand they have dealt with all these things. So they are more of anxious about judgment, anxious about what if people judge me? What if I don't sound right? Then they start getting depressed about it, about all the thoughts, the altered thoughts they are having, the perceptions they are having about themselves, the poor self-esteem, self-confidence, self-esteem issues. So treating the SM at that old age will not help them. But treating the associated symptoms like depression and anxiety with medication is what will be more likely to help them. Bilingual children, we've been talking about that. SM is more common among children who speak a second language. Being bilingual doesn't cause SM. Yes, we talk about that. So this is, when we talk about things that are not SM, things that are not selective mutism, some of these things we talk about it, and that is it. Being a bilingual, having a child that have a home that speaks multiple language dialects. Okay. Frequently asked questions. What's the difference between SM and autism or a communication disorder? This is how you get to know. And you yourself start assessing, start investigating. Does my child have a communication disorder? Is he dyslexic versus is he having a learning disability? Is it autistic or really is it SM? That's what you do. Paying attention to when a child is having trouble communicating helps determine if she has SM or something else. While communication disorders will be apparent in all situations, symptoms of SM are only noticeable in specific social situations. Likewise, kids with autism will have problems interacting socially in all circumstances, not just around certain people in their certain settings. Differential diagnosis. You see that? So a child with selective mutism have problem speaking in every situation else except with their family. But a child with autism have problems speaking, communicating in all settings, whether it's their family, whether in school, whether in society, whether at the park, the same. It stays constant across board. However, a child and a child with specific phobia also will show that they are scared or they have anxiety when they come to society. They're facing the social activities, they're engaging in schools and stuff. However, a child with SM have problem. A child in SM also have problem with this situation. However, they can communicate with their families, with their friends, people they are comfortable with. You see the difference? Is their inability to communicate or talk in every setting across board, or it's just in certain settings. These are how they do the diagnosis. Can kids grow out of SM? Let's look into this. Experts don't know how many children with selective mutism will grow out of this disorder. But what we do know is that treating it becomes much harder, and the older the child is, the worse the prognosis. So it is extremely important not to put off treatment. Additionally, the longer a child isn't able to speak or in certain settings, the longer he will be suffering emotionally. Yes. So that means they are going to have depression, anxiety issues. So because they are feeling inadequacy about themselves, they're having problems, they are fighting things in within them. Because how am I different? Everybody else is this, everybody else is that. Why not me? So emotionally, they'll be dealing with a lot within themselves. The longer he will be suffering emotionally and missing out on important social and academic development. And that is a fact, people. Will switching classes at school help? Sometimes switching to a different class or school can help since your child won't have a history of not talking there. And that's what I'm saying. They will limit the child. They'll put instead of the child being exposed to kids that are talking, take kids that are normal, they will seclude the child and put the child with kids that don't talk. So at the end of the day, the problem is I'm comfortable with people that don't talk because that's my norm. Versus I'm with kids that are talking, so I should be stimulated, I should be prompted, and I'm going to learn to undo my inability to talk and start talking like them. You see what the school system does to your kids. So you should be their primary advocate and you should seek outside help for your child versus the school help, which secludes and clusters them, packs them, and labels them and dumps them in a bubble. All right. However, switching classes doesn't always work, particularly if that is the only change that you make. If you do decide to switch classes or schools, it is best to have strategies and techniques in place before she makes the change. This might mean doing things like visiting the new classroom and meeting her new teacher before school starts. In a situation where she's not immediately expected to answer questions or speak. Ideally, a new teacher would also be trained in what selective mutism is and how to help kids who have it. Okay. What would I tell my family? Again, people are worrying about how society see their kids, how their friends see their kids. Are they going to be perceived as kids with disability? All those things come into play, and the stigma. Just like I tell you, I'm a proud divorcee. Don't come and stigmatize me because yes, I know. Don't remind me of it. That is it. The parents are now cautious and guarded and not comfortable. Who do I communicate to about this? All right, we are almost there, people. Almost. What should I tell my family? Kids with SM are often unable to speak around some extended family members, which can be stressful for everyone involved, especially the parents, right? They want to hide it. No, don't hide it. That really goes further to limit the child. Let everybody understand it so they can better understand the situation and be more, hopefully, caring enough to do what is right by your child, and then extend the teaching that you do, extend the coping, extend the learning, extend the treatment plan to them, to how so they all know how to interact and engage the child, especially to relatives that especially to relatives, what selective mutism is, and sharing how they can help if possible, or how they can help is very important. Some clinicians meet with grandparents and other important members of the extended family to coach them in how to help the child. When family members are included in the child's treatment plan, they are usually eager to help him to get better. Helpful links. Helpful links. We are done. Helpful links says that the Child Mind Institute Selective Mutism Program. In this program, the child is going to learn in a comprehensive way. It is a comprehensive treatment plan or treatment program that offers individualized evidence-based behavior intervention. Remember, I keep talking about evidence-based, right? Yes. So the Child Mind Institute, they have a selective mutism program. And this program is a comprehensive treatment program that offers individualized. Understand, everybody is not the same. Every child with selective mutism won't have the same presentation. Some will be more severely impaired, and some will be lightly impaired, and some will be high functioning. Okay. Happy new month for the people who have already entered August, people. August is my baby's month. So August is always a celebrated month for me, but my dad passed away August the 4th. So I don't know how I'm gonna feel. Yes, this month, but I'm very positive. I'm very, very positive. I'm gonna be okay. If you have a judgmental family members, what is the recommended advice? If you have a judgmental family members, what would you do with judgmental people anyway? You yourself, me, I don't deal with judgmental people. My mental health is important to me. I protect my mental health. So I will tell you, I will try and, first of all, if you are judgmental, it means I probably won't even have a relationship with you at the first. It doesn't matter if you are my father, my mom, you, my whatnot. I'll try to engage with you. Yes. But if it's unhealthy that is causing me, I personally, I engage in healthy. Remember, for you to not have your mental health affected, you choose your environment, you choose your association. So it's important that you extend the education to extended family members. But after you extend the education and they look at you and alienate you, then you stay in your corner. They don't positively impact you, influence the situation. Why not? Just stay. As the child grows, you explain it to them. What you can do is invite them over. So they are in your home and you are observing them and you are, okay, we are in 2 hours, so we have to end, which we are done anyway. You understand? You are. So what I would do with those people is first bring them to your home and see how the child interacts with you. That way they will also understand that this child actually communicates. This child actually don't have limitation. This child does great without uh, the fear when she made you strangers or you that are not actively present in his life or her life constantly. So after that, they probably will, that will decrease some of the judgments, Miss Linda. I think that would be the best way to go. Have a family gathering. How about that? Have a family gathering. My boss is calling me. I don't want to work people. Have a family gathering, and that will go a long way to solve the problem. I think so. Hello. Hello. Network is not connecting. You see that they said that, okay, it's a evidence-based behavioral intervention, including the intensive group treatment program, Brave Buddies. See, so this is a program that is structured or designed specifically for people with selective mutism. That's supposed to help them. And also, what I love about it, that it comes with a group treatment program. I appreciate you being here, and I think we are done with our 7th episode and the end of the series of anxiety. However, we are going to start within the anxiety group. We are going to start the next series. Let me tell you what that is. You see, in the anxiety, we have 3 categories. We have the trauma, right? We have the obsessive compulsive group, and we have the anxiety group. We have done 7 series. All the 7 series are seven different anxiety diagnosis. And the last one we did today is we did the panic disorders, we did agoraphobia, we did specific phobias, we did social anxiety disorders or social phobias, we did selective mutism, and we did generalized anxiety disorder. So we're gonna start the obsessive compulsive group and related disorders, and that will also be 1, 2, 3, 4, 5, 6. That will be a 6 series. So we're gonna start that next week. And then after that, we go to trauma and trauma and stressor related disorders. Thank you so much. I appreciate you for your support. I couldn't have done this without you. And so let's go and have fun on Facebook. Thank you so much for everybody that came out to support. Thank you all for your people who sponsored. Can you work 11 to 7 at Savannah Park? Over good. This week I'm trying to not work hard. I know I'm working from home tomorrow, but really I don't want to work tonight. I don't want to work. No, please. Yeah. If I work tonight, it will save me days in the week during the week to go to work. But I don't want to work. Please let me just be. Yes, thank you so much for joining. Thank you so much for joining. I appreciate you so much. And please send, you know, okay, people, let's go and have fun. The people that gaslight us, they can have part of our education. If they want it, they can come here and join us on YouTube. Trending. That's the part they like. The gossipers like. They don't like to come and learn. Let's go and trend for them. Live on YouTube, Instagram. Did I say Instagram? Please, can you close that door? Choo, 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 choo. Thank you so much, people. I appreciate you. I appreciate you for coming. I will not take you for granted because without you, I am non-relevant. Because of you, I am so relevant, so important for that person to talk about me and tell you that I am what I am causing somebody to lose their job and their license. Because of you, I feel relevant for people to talk about me. Without you, I'm not relevant. Okay. I appreciate you so very much. Those people can continue talking about us, but we are going to continue coming to YouTube and learning. All right. Thank you, my YouTube squad. We are live on Facebook. Those who didn't come from psychoeducation, it's your loss. It's your loss. It's your loss. Thank you all so much. YouTube squad.